Hello, good evening. My name is Dr. Deborah Wilson, and I'm here to talk to you about uterine fibroids. Now, uterine fibroids are benign tumors of the uterus, so they're muscle tumors. The uterus is a muscle lined by glands, and fibroids are muscle tumors, and they're very, very common. The older a woman gets, the more chance she has of developing fibroids, but fibroids can affect up to 65% of the women. There are certain populations, African American in particular, and those women have an even higher incidence of fibroids. Fibroids are very hereditary. So if your mom had fibroids, your sister has fibroids, you're likely to have fibroids. So as I said, they're generally benign. It's very rare for a fibroid to develop malignant cells, but so they're very, they're benign, and in most women, they're not much of a problem. Women live with fibroids for years, but some fibroids can grow, and they can grow so large that they can cause pressure in the pelvis. They can impinge on the uterine lining and cause bleeding, cramping. So fibroids can be a huge problem, and it's one of the most common reasons women actually end up seeking out a hysterectomy, because they're bleeding. Sometimes they bleed like all month long, or they bleed extremely heavily, become anemic, or they have a lot of pain. Cramping with their periods, just generalized pain in the pelvis. So depending on the size of the fibroids, they can become a real problem. So what do if you have fibroids? Say you have fairly large fibroids, you're bleeding heavily, you're cramping, it's become a problem. It's become a real distraction in your life, and maybe you're off work 1 or 2 days a month just because of the problems that the fibroids are causing. So you talk to your doctor, and there are a number of options in managing fibroids, but of course the most common is hysterectomy. So you go see your doctor, and you have relatively large fibroids. You didn't really know it, you didn't go to the doctor for a while, but your fibroids are pretty large. You have options when it comes to hysterectomy, and this is really the point of me talking about this tonight. Many doctors will recommend a laparotomy or a large incision to get out fibroids or to remove the uterus. If a woman is beyond her childbearing years, really removing the uterus is the best option. We can remove fibroids. It's a relatively technical procedure, and the problem is that fibroids will tend to grow back. So, if you're going to have a surgery and you're done with kids, it's probably best to just get the uterus out of there, so there's no possibility of developing more fibroids. So, your doctor is going to tell you, well, let's do a hysterectomy. You need surgery, and for the most part, a relatively large incision is necessary. But over the past few years, some surgeons have developed a technique of getting fibroids out through small incisions. So what we do in order to get fibroids out through small incisions is we operate looking at a screen. So we have small incisions and put our instruments through the small incisions. We release the uterus by coagulating the blood vessels and cutting. Once we have the uterus free, we can actually put a bag in the abdominal cavity, put the uterus in the bag, bring it out through the largest incision, which is only about like that, about a centimeter and 1.2 centimeters, and bring the strips of the uterus out through the belly button. It's a safe way of doing it. There's no spillage of cells, so you don't have to worry about, just in case the fibroid had cancer cells, spreading the cancer cells around the abdominal cavity. You don't have to worry about fluid being left in the abdominal cavity. So it's a very highly technical procedure, but if you are someone who has fibroids and you want to avoid a large incision, you need to seek out a physician who would be willing to do this surgery for you. We've done hundreds at this point, and patients do extremely well, and they're awfully happy that they didn't have to have a large incision and a big recovery time, because the recovery time from a laparoscopic hysterectomy is a fraction of what it is for a big incision. So if you do have fibroids and you go see your doctor and your doctor says, well, the only way to get it out is through a large incision, you need to just keep looking and find someone who can actually get it out through small incisions in a bag morselization way. So this again is a technique that is highly technical. Not all surgeons can do it or feel comfortable doing it, but you really do need to make sure that you've explored all your options. Thank you very much.